This is Mr. Coco, and welcome to my class. So today we are looking at IEC, and IEC, this is IEC on discharge. So IEC on discharge, so what points can you raise? So we are looking at the possible points that you can raise during discharge of a patient. So, but if you get this IEC, doesn't mean that you are restricted to this IEC. You can write or give IEC in a way that you feel, or perhaps depending on the patient's condition. So let's say possible IEC that you can give on discharge. Number one can be review date. So if you look at review date, what points can you raise under review date? Because as students, even those who are qualified, you're supposed to underline that and say this is the main heading, which is review date. So what can come under review date? So review date, you need to explain to the patient the importance. So explain to the patient the importance of review date. You need to tell the patient that review date gives them an opportunity. So it gives them an opportunity. This opportunity will be there to assess the prognosis. Okay, so you just assess the prognosis under this importance of review date. So under importance, you need to explain. So it's important for the patient to come for a review because the doctor or the nurses will assess the prognosis, okay, or how the patient is doing. Are they recovering or they're not recovering? Okay, so this is the point under importance. Then second point under review date would be it gives them chance. So this gives chance. Review date gives chance to the patient. Gives chance to the patient to have a refill of drugs. So we're going to say refill of drugs, meaning in case the drugs not really going up to a month or a week, the doctor would decide to say, okay, let them have some more drugs. So meaning they'll have a refill of drugs. Another point under give them chance would be give them chance also to to replace or to remove medication. So remove medication from the regime. So remove medication from the regime. So the doctor will say, okay, maybe these drugs are too many, so let's remove some drugs. So it will give them chance to remove some drugs. So this is why review date is important. Another heading under review date would be it gives chance or room, gives room for psychological support. So it will give room for psychological support. This means that if a patient has been suffering from a condition, it will, how patients do it when they are having maybe a chronic condition. Their mood will be low. So they have maybe their mood will be low, or they'll have mood swings, or they'll just they'll be getting psychologically affected. So this review will be able to give them room for psychological support so that the healthcare personnel, works on their mood swings. So it's very important you should explain to the patient about psychological support when they come to for review. Okay, then another point under review date, it provides chance. So this one will provide chance. Then this chance it provides is for build up of knowledge. So meaning there will be an increase in knowledge, in the sense that the health professional will be able to explain, to say, okay, the condition deals with this, how you can treat the condition is this, how you can maybe handle the signs and symptoms or the triggers to the condition is this. So this gives or provides chance in the sense that the health professionals will have an opportunity to teach the patient. So this is how come this is very good in terms of review date. So we have to move on to the next one, which is a medication. In case you identified your IEC to say medication, what can you write? What are the possible, maybe say headings that you can come up with in terms of medication? So under medication, let's say medication, this is number 2. So under medication, what you can come up with is you need to explain the importance. Okay, you need to explain the importance of taking medicine, so the patient should understand why they're taking that medicine. So you need to explain to them that this will promote recovery. Okay, so to promote recovery, that's why you need to explain about the importance of taking medicines. They need to know that they'll recover, or their life will be preserved. Then you need to teach. As a healthcare practitioner, you need to teach. What do you need to teach? You need to teach about time of taking the drug. You need to explain and emphasize about the timing so that they don't skip time. Then again, you need to explain about the route, meaning is it supposed to be taken orally, or is the drug supposed to be taken IV, or which route is the drug supposed to be taken? Is it intradermal? Is it subcutaneous? You need to explain the route so that the patient understands. Then again, you need also to teach. Another teaching that you need to look at is about the side effects, because drugs have side effects, so you need to explain so that the patient should know the possible side effects that that drug has. So you need to explain about it. And maybe if the drug requires them to rest or not to drive, you need to explain all those things. They should come out. Then another thing that should come out under medication is safekeeping of drugs. So safekeeping of drugs, meaning when we talk about safekeeping of drugs, we're talking about keeping drugs away from children. So you need to teach the patient to keep drugs away from children so that children do not intoxicate themselves. So they should be kept safe where children cannot reach. Then another heading under medication will be drug compliancy. So you need to explain to the patient about compliancy, meaning they should stick to the regime. Okay, they should stick to the regime, they should follow the timings, they should not skip so that they recover quickly, or the drug should not cause resistance. Okay, so let's move on to the other heading, the number 3 heading. Under number 3, we've got nutrition. So under nutrition, we all know that anybody, or even when they're not sick, they're supposed to eat. Now this patient will be having drugs to take, so they need also to eat so that they promote quick recovery. So you need to explain the importance of nutrition as well. So what's the importance of nutrition? You need to tell them that when they eat health foods, their health will improve, so they'll become healthy. So you need to explain to them, say, when you eat, you become healthy. So you need to explain the importance of eating healthy foods. Another thing that will come up under nutrition will be diet. So now diet, depending on the condition, what kind of food should they eat? Okay, in this one. So you need to look at the condition of the patient. If it means that they have to eat a high protein diet, you need to explain to them why they should eat a high protein diet, meaning this has to replace worn out tissue. Then if it's a high carbohydrate, so meaning high carbo, you need to explain. So this will be there for energy. You need to tell them, you need to explain why. Then if they have to eat a high vitamin diet, you need to explain why they should have a high vitamin diet, because this will boost their immunity. Then if they have to eat a low salt diet, you need to explain why they should not have foods that contain high salt, because high salt meaning they'll have water retention. So you need to explain to them. Then if the food they're eating, maybe say we look at restriction of fluids, restriction or restricted H2O, which is maybe water or fluids, you need to explain why maybe their diet shouldn't contain a lot of water. For example, they are restricted, maybe per day they should drink maybe 1 liter, which is 1000 mils per day. You need to explain according to the condition. For example, renal conditions, those who are maybe who have got renal failure, need to tell them, need to explain why fluids have been restricted. We don't want them to have edema or have hypertension because of the fluids or fluid retention. So we move on to the other one. In case you are dealing with this patient who's been in hospital for a very long time, you need to go to the 4th one, which is stress management. So under stress management, you need all the patients, those who are discharged, they've got some form of stress. So you need to also emphasize on stress management so that this patient does not commit suicide, or this patient does not start having self-pity, so that they also improve, because managing the mind also is very important. So we're looking at this stress management. You need to encourage the patient to be taking a bath. A bath is so relieving, so this relieves the stress, because all the muscles will be able to be massaged and blood circulation will be improved. So the patient will feel relaxed. So this will relax the patient. So you need to emphasize on that. Then again, the patient need to maybe watch TV or use a radio to listen to something, so that at least their mind is diverted away from their sickness or their illness. This will help them recover quickly. Then they should also take a walk. Taking a walk helps because they'll be able to see other different images around the environment, and this will help them recover quickly because they're taking walks. Then another bit that they should do is talk to somebody, talk to someone. Meaning, if they talk to someone maybe about things that are affecting them, they'll be able to find maybe good advice or other ways of recovering, because they're able to share their ideas and how they're feeling and what's going on with them. So other people will be able to help them. So talking to someone is also very important. So let's look at the fifth one. The fifth one is lifestyle. So lifestyle also depends on the condition, because there are those sicknesses where you can identify that the patient drinks a lot and maybe it's affecting their life or their health. So let's look at health behaviors. So under health lifestyle, we look at health behaviors. So health behavior. So under health behaviors, we look at issues like, say, for example, smoking. You need to talk to this patient. If smoking is affecting their health, you need to tell them to stop smoking. So you need to encourage them that, they should stop smoking so that their health improves. If, for example, if it's alcohol affecting their life, you need to tell them to reduce or stop alcohol so that they improve or they recover quickly. So you need to look at that health behavior. Then another part about lifestyle is exercises. You'll find that most people do not exercise. So depending on the condition, you'd tell the patient to really exercise maybe 3 times a week. 3 times a week for 30 minutes. So 3 times a week, then every time they exercise, at least they should exercise for 30 minutes, 3 times a week, so that they recover quickly, because exercises really improves somebody's lifestyle. Then under lifestyle, we should also look at eating habits. So you talk about and explain about eating habits, meaning the patients should be able to eat healthy foods, not really just eating junk. For example, just having street foods so that they quench their maybe hunger. They should be able to eat healthy foods such as vegetables. So they should include veggies. And if it's in Zambia, we'll look at tanshima, and we look at, apart from veggies, we look at meat so that they recover. This will give them the necessary things or nutrients they need. But junk or junky foods do not give them the necessary nutrients. So let's look at the sixth one. The sixth one is teaching clients about the condition. So we're going to look at teaching clients about the condition. So you need to teach them about the condition, because when you teach them about the condition, meaning you're going to teach about the triggers. For example, those who are asthmatic, you really have to tell them what's really causing them to go into an asthmatic attack. So you need to really look at that. Or for example, if you are teaching those who are diabetic, those who are asthmatic, you teach them about their triggers. Those who are diabetic, you really have to teach them about what's really causing their sugar to go up or to go low. So you need also to explain. So depending on the condition, you have to teach about the triggers or the cause of the attack. Then again, you need also to really teach patients about signs and symptoms. It's very important patients to know signs and symptoms of the condition, because it will help them to know and identify, this condition I'm suffering from, it's the signs and symptoms are categorized as this. So it will help them really identify and report to you as they come for review. Then you have to also teach them about the relief strategy. So what I mean by relief strategy is that you really have to talk about it in the sense that we need to talk about home remedies. What I mean by home remedy is that there are those things that they can use at home to relieve the attack or to really lessen the signs and symptoms of the condition. And also, you need to teach them about drugs, meaning they should not really buy counter drugs. They should always get drugs from the hospital, okay, not from the counter, so that at least they should be able to recover quickly, because from the counter they might not prescribe them correctly. So I really just encourage them to go to the hospital. So under these headings we've looked at, we can lastly look at hygiene. So under hygiene, hygiene is very important to every patient. So you have to really look at hygiene. So under hygiene, in this case, you need to emphasize about the need of hand washing. So they need to look at hand washing, meaning each time they use the toilet, they have to wash their hands, or each time they want to maybe touch food, they need to wash their hands, so that at least they do not have those infections that are gotten maybe from the feces, which is fecal oral route. They shouldn't really acquire those, so they should be able to wash their hands. Then another thing that you look at is personal hygiene. Personal hygiene, meaning this patient has to take a bath. They should take a bath daily so that they improve their self-esteem. They should also do oral care so that at least they improve their mouth and they don't really have those complications of a dirty mouth such as halitosis. So you need to teach about these things. So this is about IEC. So you can have as many as possible in terms of headings, and this is not just limited. So you can have so many. Thank you very much for listening. We'll come back for another episode.